What are polyps and do they cause rectal bleeding? Imagine a tiny growth forming inside your colon or rectum that might not cause any pain or discomfort. These are called polyps, and they are quite common. Polyps are abnormal tissue growths that develop on the lining of the large intestine or rectum. Most of the time, they are benign, meaning they are not cancerous. However, some types, especially adenomatous polyps, have the potential to turn into colorectal cancer over time if left untreated. Polyps form because of abnormal cell growth, often triggered by genetic changes that cause cells to multiply faster than normal. This process can happen for many reasons, including age, family history, or certain lifestyle factors. Interestingly, most people with colon or rectal polyps do not notice any symptoms. These growths are often found during routine screening tests like colonoscopies, which are recommended starting at age 45 or earlier if you have risk factors. While many polyps cause no symptoms, larger ones can lead to rectal bleeding. This bleeding might show up as blood on toilet paper, mixed in with stool, or sometimes as black, tarry stools if the bleeding is slow and ongoing. Sometimes the bleeding is so minor that it's invisible, but it can still cause iron deficiency anemia, leading to feelings of fatigue or shortness of breath. Larger polyps may also cause changes in bowel habits, such as diarrhea or constipation, and in some cases, you might notice mucus in your stool or experience abdominal discomfort. It's important to understand that rectal bleeding can be caused by many other conditions too, like hemorrhoids, anal fissures, infections, or even colorectal cancer. Because of this, any bleeding from the rectum should be evaluated by a healthcare professional. They can perform tests to determine the cause and recommend appropriate treatment. From a health perspective focused on preventing colorectal cancer, detecting and removing polyps early is vital. Removing polyps during a colonoscopy can significantly reduce the risk of these growths developing into cancer later on. That's why regular screening is recommended, especially for those over 45 or with risk factors like family history or certain medical conditions. In summary, polyps are growths on the lining of your colon or rectum that are usually harmless but can sometimes cause rectal bleeding. While bleeding might be a sign of a polyp, it can also indicate other issues, so seeing a healthcare provider is essential. Early detection and removal of polyps through screening can help prevent colorectal cancer and keep your colon healthy. Always consult your doctor for personalized advice and appropriate testing if you notice any symptoms.